It is very common to find one person who is suffering from seemingly very different conditions all at the same time. Let's take, for example, somebody who is suffering from depression, anxiety. They also got joint pain, and maybe they've got a skin condition like excessive acne or rosacea, and even maybe this person also has got severe PMS. So these seemingly different conditions can have a common root cause. So there is what we call a gut-brain axis, gut-skin axis, gut-bone axis, gut-immune system axis, gut-hormone axis, gut-thyroid axis. So what this means is that usually there is a gut problem that's present and is manifesting in different body parts as different conditions. So instead of trying to spot treat all these conditions, by probably visiting one specialist, you go to even a cardiologist, because we also got a gut heart axis. So the most plausible thing to do is to ask, are all these conditions related? And in most of the cases, these conditions are related. They've got a gut origin. So let's take, for example, the gut-brain axis. We talk about somebody that has got anxiety or depression. So those chemical substances, the neurotransmitters that are responsible for regulating your mood, they are made by a specific group of bacteria in the gut, and if you don't have those bacteria, you're gonna suffer from anxiety. Let's look at gut-liver axis. So whatever happens in the gut, okay, is going to affect what's happening in the liver, because the gut and the liver are connected through the portal vein. So whatever happens in the gut, the nutrients will travel through that portal vein to the liver. A very interesting example is people that suffer from non-alcoholic fatty liver disease. In most of the cases, this is actually due to fermentation in the gut, and then the fermentation process will produce alcohol. The alcohol will then cause non-alcoholic fatty liver disease, but in actual fact, this is alcohol that's being made by bad bacteria in your gut. So it makes sense you need to heal the gut. Let's talk about the gut hormone axis. Okay, we know that there's a group of bacteria in the gut called the estrobolome, and it's responsible for detoxification and regulating estrogen in the body. And if there is an imbalance as far as the gut bacteria is concerned, the person will suffer from things like PMS, PMDD, and endometriosis. So instead of trying to find maybe even a hormone solution to this, it is actually a gut problem. You need to balance those gut bacteria. Another one is a gut thyroid axis. Okay, people that have got thyroid conditions, we know very well that the thyroid hormones, let's say T4 and T3. T4 is converted. Some of it is converted in the kidneys and the liver, but some of it is actually converted in the gut from T4 to T3, T3 being the active hormone. So you find somebody who's got hypothyroid is due to the fact that they are not converting T4 to T3. So there you've got your gut thyroid axis. So instead of spot treating different conditions, especially if they are occurring at the same time, most likely they've got a communal cause, and invariably this has got to do with the gut. So before you run from one specialist to the other, there is a place for specialist treatment. But before you do that, ask yourself, is there a commonality between all these seemingly different conditions?